Welcome to the Behavioral Health Care Services Briefing. The goal of today's presentation is to help you understand behavioral health issues and to explain when and how to get care. During today's briefing, we will explain what behavioral health is and when to get help. Then we'll talk about behavioral health care services covered by TRICARE and describe the guidelines for getting care. And then we'll give you some important contact information. Behavioral health is a term used interchangeably with mental health. It describes the way a person thinks, feels, and acts when faced with life situations. Behavioral health involves how people look at themselves and their lives, evaluate challenges, and make decisions. Military life is challenging and often unpredictable for service members and their families. Deployments, moves, and extended separations are just a few examples of the stresses you face, and it's not uncommon for these factors to lead to feelings of anxiety, anger, or sadness. When stress is minimized or well managed, these feelings should ultimately pass. However, serious issues can arise when you are exposed to long-term stress. Behavioral health problems can affect your thoughts, feelings, behavior, and even your physical health. A behavioral health problem is not just a passing phase. It can weaken your immune system, impact your relationships, and hurt your performance at work or school. Some emotional difficulties will go away with time, but behavioral health problems can worsen if left untreated. Don't wait for an emergency to get help. If you are unsure whether you or someone you care about needs help, go to the TRICARE Mental Health Resource page for an anonymous self-screening and other helpful resources. Many people are reluctant to get help because they're afraid a stigma surrounds behavioral health problems that could affect their career or social life. Sometimes people try to convince themselves the problem will go away on its own. They just have to tough it out. Our military leadership recognizes the needs to address behavioral health care issues and encourages people to get help before it's too late. There are a variety of resources to help you. The TRICARE Assistance Program is a web-based program that uses audiovisual features to provide online access to confidential counseling for short-term, non-medical issues. This program is available to active duty service members and spouses of any age and other beneficiaries age 18 and older who are active duty family members. TRICARE reserves select enrollees or in the Transitional Assistant Management Program. The Telemental Health Program enables treatment through the use of medically supervised, secure audiovisual conferencing to connect beneficiaries with off-site behavioral health providers. Services are provided at a TRICARE authorized provider's office or facility. This program is useful when distance makes it difficult to access behavioral health care services. For more information, contact your regional provider. Outpatient services are behavioral health care services, such as appointments with psychiatrists, psychologists, social workers, and other behavioral health professionals that can be provided without an overnight stay. Inpatient services are behavioral health care services that require an overnight stay, such as rehabilitation for substance abuse disorders. A behavioral health emergency occurs when the physical well-being of an individual or those around him or her is at risk. If you or someone you know experiences a behavioral health emergency, call 911 or go to the nearest emergency care facility, or call the National Suicide Prevention Line. Military life, especially deployments, can present unique challenges to you as a service member. You can contact your regional contractor to access confidential counseling services through the web-based TRICARE Assistance Program. No referrals or authorizations are necessary. You can also see your primary care manager or self-refer to the local military behavioral health or life skills clinic. Remember that referrals are necessary for all non-emergency civilian care. All non-emergency inpatient admissions require prior authorization from your primary care manager or military medical support office service point of contact. In the event of an emergency, call 911 or go to the nearest emergency room. Prior authorizations are not required, but if admitted, you should work with the facility to contact your primary care manager or service point of contact to obtain a continued stay authorization. Active duty family members and TRICARE Reserve Select enrollees can contact their regional contractor to access confidential counseling services for short-term, non-medical issues through the web-based TRICARE Assistance Program. Active duty family members, retired service members and their families, and other TRICARE beneficiaries can self-refer to a TRICARE network provider for the first 8 outpatient behavioral health care visits per fiscal year, which is October 1st through September 30th. Please note, physician referrals are required for services received from licensed professional counselors and licensed mental health counselors, which need physician supervision to be covered by TRICARE. Prior authorization from your regional contractor is required for all non-emergency inpatient behavioral health care. In the event of an emergency, call 911 or go to the nearest emergency room. If admitted, contact your primary care manager or regional contractor to obtain a continued stay authorization. TRICARE is the last payer after other health insurance in almost all situations, so you should file claims with your other health insurance first and follow their rules for getting care. After your other health insurance pays, TRICARE will pay what's left for covered services up to the amount TRICARE would have paid if you didn't have other health insurance. If your other health insurance has run out, or if the services you need are covered by TRICARE and not your other health insurance, TRICARE becomes the primary payer. If this happens, you will need documentation showing that coverage was denied by your other health insurance. From there, you should follow TRICARE guidelines for getting care. In an effort to protect the privacy of TRICARE beneficiaries, the Department of Defense is removing Social Security numbers from military identification cards, including the Common Access Card. Your new ID card will have one or both of the following: a 10-digit DoD ID number instead of your Social Security number, a DoD benefits number if you're eligible for DoD benefits. Please note, not all ID card holders are eligible for DoD benefits. You will not need a new ID card until your old card expires. For more information, visit www.tricare.mil/SSN. In summary, TRICARE provides multiple behavioral health care services to help you get the care you need. You can self-refer for most outpatient services and work with your primary care manager and regional contractor to get authorizations for inpatient care. Remember that active duty service members must have a referral or authorization before seeking civilian care. Please don't wait for a crisis, but in the event of an emergency, call 911 or go to the nearest emergency room. The following slides provide additional information on the resources available to you. TRICARE is managed in 3 regions in the United States: TRICARE North, TRICARE South, and TRICARE West.